In the first video, we discussed balloon pump basics, setup, triggers, and timing. In this brief, yet equally important discussion, emergency procedures and aircraft equipment loading will be the primary topics. Loading the patient and balloon pump into the rotor-wing aircraft is all about positioning. It is important that you know where the balloon insertion site is and how much cord and tubing you have. Also, ensure that the wheels of the pump are locked down and that the pump is in close proximity to the aircraft. The patient is then carefully loaded into the aircraft and rotated into position. Again, keep in mind how much tubing and cord length that you have to work with. Then, when the patient is locked into place inside the cabin of the aircraft, a two-person lift of the pump is performed. The pump wheels are locked in place and the pump is secured by straps that are anchored to the floor. The pump control console may be removed from the pump for easy access. Loading the patient into the citation is a slightly different approach with different logistical challenges. The pump will end up in the back of the aircraft on the cargo deck, and the height in which the pump is lifted is almost twice that of the rotor wing. With that said, preparation and positioning is still key. The pump will be loaded first, and the patient will then be loaded into the aircraft feet first. Ensure that there is someone specifically assigned to watch all of the attached lines, tubes, and cables throughout the transfer process. And again, lifting the pump in an ergonomic fashion utilizing at least 2 crew members is vital for patient and crew member safety. As the pump is slid through the narrow loading door, begin moving the patient towards the aircraft loading platform. Coordination is key as the patient and the pump are being moved into the cabin of the aircraft simultaneously. It is also important to note that the wheelbase of the balloon pump is wider than the life port litter base, so great care must be taken to move the pump into position once in the aircraft. The final destination for the pump will be the cargo deck with the pump strapped down, wheels locked, and clipped to the floor. If the pump fails, you will need to manually inflate and deflate the balloon in order to prevent clot formation. In order to do this, you will use a 60 milliliter syringe. Before manually inflating the balloon, assess the helium line for blood. If no blood is present, attach the syringe to the gas line connection and aspirate the balloon. If the line is clear, disconnect the syringe from the tubing, pull the plunger back to the size of the balloon volume, reconnect the syringe to the gas line, and rapidly inflate and deflate. This should be done once or twice every 5 minutes. If blood is found in the helium line, this indicates that the balloon has ruptured. Discontinue pumping and clamp the catheter. If your patient goes into cardiac arrest, there are no alterations in your ACLS or BLS guidelines. With respect to the balloon pump, the arterial pressure or AP trigger will be your trigger of choice. This is done automatically by the pump if for some reason your ECG wires come disconnected. The pump should remain in the autopilot mode in a 1-to-1 assist ratio. With the pump in autopilot mode, once sufficient pressure is generated during external chest compressions, the AP trigger will automatically be selected and pumping will resume. If the AP trigger does not initiate pumping, you may alternatively select operator mode and use the internal trigger. However, if pumping is not initiated with chest compressions, it probably means that your compressions are not deep enough. The arrhythmia timing key is in the upper right-hand corner of the control panel and activates or deactivates the arrhythmia timing and or R-wave deflation function of the pump when in the autopilot mode. The AutoCat 2 system will automatically recognize arrhythmias and implement real-time R-wave deflation when the arrhythmia timing function is on and conditions are acceptable for R-wave deflation. This will be indicated by the LED light being on.